Okay, so I'm Luigi Rebuffi. I'm Secretary General of ECSO and Women for Cyber, and we have this panel, How to Protect the Health Sector from Malicious Actors. We have Madame Christiane Kirketerp de Viron, who is the Acting Director for Digital Society and Trust and Cybersecurity of the European Commission. We have Sami Khoury from the Government of Canada, and Christophe Mattler, Director from the Ministry for Health in France, and Paolo Palumbo, who is Vice President at WithSecure, so the only representative from the private sector. Well, I asked them to have a first introductory statement of about 4 or 5 minutes to present their different point of view. Paolo will present somehow the technical and threats point of view. Christiane will tell us maybe about what Europe is doing. Sami will tell us what Canada is doing, and Christophe what France is doing. And then we go deeper in the discussion. But first of all, I would like a quick question to you. If you want to invest money in cybersecurity, maybe your personal money. If you want to invest money in cybersecurity, I give you 3 choices, and you raise your hand. The choices are between the finance sector, the energy sector, and the health sector. Which one would you choose? First of all, raise your hand if you want to invest in the finance sector. 1, 2, 3. If you want to invest in the energy sector, more money, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, something like. If you want to invest your money in the health sector, so maybe, I think you choose the right panel. Thank you. So let's go for it. And so Paolo, tell us a little bit about you're the technical specialist in this, and give me what are the current and possible cyber threat you see in this sector.
Let's see if my technical expertise is good enough to get the microphone working. It seems so. Yeah, so welcome. It's really a pleasure to be here. It's a privilege to be able to address all of you on this topic. When Luigi asked me to introduce a bit the situation when it comes to cyber threats affecting the health sector, I had to think a bit, because it's very easy to go into the doom and gloom of all these threats. But I still think it's good for us to get on the same page of what we are seeing out there global, right? The healthcare sector remains extremely targeted by threat actors. Usually we see ransomware being the prime threat affecting this sector. Not the only threat, but still a predominantly large amount of the threat comes from ransomware operations. And these happen at the hand of cyber criminal groups, right? So there is a small tail of attacks that have to do with cyber espionage, especially in the pharmaceutical research area. But again, it remains very limited. What is important to me here, rather than going into a plethora of cases that I could bring to this audience, is to discuss the impact of a ransomware operation affecting healthcare entities, right? So the first thing, an obvious impact that we need to consider, is the financial damage coming from the ransom itself. This sounds like, again, we've heard it many times, but I need to remind all of you that the largest reported ransom payment of $75 million happened allegedly to be paid by a company in the healthcare sector, right? So that's something that frames the impact for this kind of environment. On top of it, we have the operational cost. For every day in which an organization in the healthcare sector does not operate due to ransomware, we end up having massive financial losses in the hundreds of thousands per day, depending on the organization. But also there is a medical and human cost that reflects in the fact that this organization cannot serve the patients that they would have otherwise served. So for every day that these companies and organizations do not operate, there is human cost and there is financial cost. And we have reached already the point in which we have been linking the death of people to a cybersecurity problem. 5 years ago, in Germany, an hospital in Düsseldorf was affected by a ransomware attack. When that happened, a person en route to that hospital needing urgent medical care could not be serviced and had to be rerouted to a nearby hospital. Unfortunately, the person did not make it to the delay that was introduced in the rerouting process. That shows you that this is very real. It's not just, hype building and all of this. Finally, we also introduce, with these attacks, we introduce operational risks to society at large. Like whenever you have an hospital being impacted by a ransomware operation, you see an increased stress on hospitals in the surrounding area because they have to address the load of the patients that cannot be serviced by the impacted organization. So this is maybe one side of it. The other side is that you have to look at the data that is being involved in this kind of breaches, right? This is data that is among the most sensitive and most lucrative for threat actors out there. We see cases in which this data is used for blackmail. Like a few years back in Finland, where my company is based, we had a famous case called, relating to a company called Vastamo. Some of you might remember that. That was a horrible case because Vastamo was a medical private provider of mental health services. This company got breached. A vast amount of therapy data and notes got exfiltrated, and the actor started blackmailing the victims, saying, if you don't pay us, we will release your the notes from your therapy session. That's a devastating blow for the individuals impacted. Luckily, the actor there was rather shoddy, so it was not as bad as it could have been. But it gives you an idea of the drama. There are also some interesting side effects toward physical security. Some of the organizations in the healthcare sector need to serve their customers, to possess information on how, for example, to enter the home of a person that requires physical assistance. If these systems are breached and that information is made available, the physical security of the patients is at risk. And that sounds really horrible because it is really horrible. Luckily, we don't have any case that has been documented that is happening. We have a case of such an organization being breached in the United Kingdom last year. The situation grows in complexity. Like we have hospitals and medical sectors being embedded in a very complicated supply chain, right? Sometimes the supply chain is rather standard. They use software that has been produced by a commonplace software house, which doesn't do their job necessarily at the level that is required, introducing vulnerabilities in software, which then get exploited, and you know how the story ends. But there are also other cases. Some of the organizations in the healthcare sector rely on upstream service providers, such as laboratories that provide medical specialized tests. If any of these organizations get breached, not only they're unable to do their job, but the downstream of their operation is impacted, causing damage and disservice. So it is a very unpleasant threat landscape, the one that affects the healthcare sector. And it highlights, I think, the importance of us having this discussion, because what is at stake is much more than money or something kind of very concrete like that. There is the health of people at stake here.
Yeah, and that's exactly, I think, what maybe so the reaction people were very interested in investing in cybersecurity, maybe than in energy or finance, because probably it's something that feel it personally, because you need health first to enjoy all the rest. And this is something that changed also with the time, because Christiane, you remember last year, beginning of the year, I made a market study for the Commission, and I recognized at that time that US were very advanced, and we will come back with Sami on that, very advanced, but Europe was quite lacking behind, though recognizing it's an important topic, but still I was seeing that something was coming up. And this year, in January, you published a European action plan for cybersecurity for hospitals. So tell us what is the situation in Europe?
Yes, thank you. And first of all, thank you for inviting me to come here. come back to the Paris Cyber Summit to discuss this very important topic. Because indeed, it was actually the very first thing that the new commission, so the von der Leyen II Commission, published as a new commission. It was our health action, cybersecurity action plan. And I think that also really underlines how much importance that we attach to this. And I very much appreciated that you were the deliverer of the bad news on the threat landscape, because that's of course one of the things that are also driving our urge and need to do something in this space. I think the other thing that we also need to look at is the fact that it's not just that the threat landscape is dire, it's not just that it's a very critical sector, it's also the fact that maturity level is not where it should be in this sector, right? And I'm not talking only hospitals, I'm talking about the broader ecosystem. And this is what we see when we're looking at the incidents that are happening, when we're looking at the ransomware attacks. We see that a lot of the things could actually have been prevented by having in place some of the fundamental good things to do in cybersecurity. And this is also something, of course, that we need to take into account when we're moving forward. I think the other thing we also need to think about is that in Europe now, we're looking very much in this notion of preparedness union, in our internal security strategy. There's a lot of drive around thinking worst case scenarios, what do we need in order to be ready? And here again, hospitals are a very critical sector. They play a critical role for our society, for our preparedness. So that's also, of course, a driver for it. So overall, the intention and the ambition is to really give an uplift to a sector. So how are we going to do that? I think, first of all, we all recognize that more rules are not going to fix any problems here, right? We have, and I will say it with all the pride, I think we have a very nice framework already on cybersecurity rules. Delivered, done, now needed to be implemented, NIS2 Cyber Resilience Act. So the rules have been made, now we need to really make an investment into making them work for cybersecurity and into making them work for our businesses. And this is part of the focus we're doing here, because our action plan is a lot about capacity building. It's about leveraging our cyber agency, ENISA, to actually being able to provide the guidance to support our entities to actually meet the different requirements in our laws, but also to focus the investments on where they are. Because let's be honest, most hospitals and healthcare providers in Europe are public. They do not have endless budgets, and when they do have budgets, they tend to focus on patient care, as they also should. So we do have an investment issue here, and that's also why part of our action plan is actually also about focusing, further money into the sector. How do we leverage the different funds we had at the European level? How do we get national and regional funds to actually uplift our hospitals and healthcare providers in terms of cybersecurity? And I think here we've learned, when we were preparing it, we were also looking around in Europe and seeing, are there good examples around here? And I think what has happened here in France is a very good example in terms of the CARE program, where they have really uplifted cybersecurity in the hospital sector. So all of these is also part of it. We have been looking at what are the good practices and how do we roll this out in Europe in a broader perspective. One thing is, of course, you look at what do the entities need to do, what can the hospitals do, but you also mentioned very importantly the supply chain. And I think that's something we should not forget when we're looking at the cybersecurity situation. We need to look at the security of our medical devices. Are they at the level they should be at? So here it's one of the areas where we also said we would like to go forward now with a risk assessment to really understand where do we have specific issues in the supply chain in medical devices that needs to be addressed, whether they're technical or strategic. And finally, I would say there's a big focus also on the issue of ransomware, because if we're looking, as you also mentioned, if we're looking at who's actually coming after our hospitals and healthcare providers, it is very much driven by cybercrime. So here, of course, our colleagues at Europol are already doing an incredible work. But there's also room to look more internationally for the cooperation, and I'm happy Sami is also here, because I think this is this is a threat that you cannot deal with alone. There is an international dimension on ransomware, and it's a place where we really need to have a global effort to actually address this properly. So overall, our action plan is a menu. It's a lot of different things that we have seen that makes a difference. We're now working with our member states, with our industry, discussing, where do we put the focus now? Where do we start? Because, it's expensive to do cybersecurity, so we also have to prioritize. And we will be, on this basis, be coming back then with some recommendations on how do we roll it out. Thanks.
Thank you, Christiane. And okay, there are already coming to my mind some questions for the following discussion. But now let's go to Sami, who is the senior official for cybersecurity of the government of Canada. And I meet Sami from this period quite frequently. So you know Europe quite well, and you know also what is happening in Canada. I would like to maybe to know what is the situation there. Also, we were discussing about with respect to the US. The US is a very mature market where they have private, exactly what Christiane was saying. Here is more public, in the US is very much private, so they have a different dynamics and resources. What is the situation in Canada, and what is the best practice maybe that you could bring from Canada to Europe?
Thanks, Luigi, and thanks for being part of this panel, and also to be back at the Paris Cyber Summit for another year. I'll give you a perspective on what's happening in Canada, maybe in three parts. What to set the scene, how is Canada organized, maybe a bit of the threat landscape as we see it, but also what are we doing domestically, but also internationally. So I'll structure my 4 to 5 minutes thoughts on those three buckets. I was here last year. I was wearing a different hat. I was wearing the hat of the head of the Cyber Center. Now I'm back wearing a different hat, but nevertheless, still in the cyberspace. Canada is a federation, so healthcare is one of our 10 critical infrastructure sector, but it's a sector that is under provincial jurisdiction. So the federal government, while funds the provinces, we don't, as a federal government, we don't dictate on the provinces how they spend the money on healthcare, and we don't dictate how they do cybersecurity in healthcare. Having said that, the healthcare is a universal right for Canadians. So every Canadian, it's a publicly funded system, and every Canadian has the right to have healthcare anywhere in Canada. They're entitled to those services. But over the years, the pressure on the healthcare system has been growing constantly, which funding becomes an issue. And as Christiane aptly pointed out, given $1, they would spend it on patient care as opposed to maybe investing in cybersecurity. And that's a very tough choice to put a hospital in, or a very tough choice to put a province in, to say, I'm increasing your healthcare budget, but obviously you have to meet the demands of your citizen, and how do you balance that? We've had 2 big cyber incidents in Canada that unfortunately have had devastating impact. One, 2 months into my tenure as the head of the Cyber Center, the province of Newfoundland, one of the provinces of Canada, was hit with a ransomware attack that was in November of 2021. Which resulted in the shutdown of the healthcare system of that province. So for a few weeks, that province's entire healthcare system was completely offline. They can still provide some healthcare services to citizens, but all the IT that was supporting it went offline. It was a ransomware case, data was stolen, and it was Hive, the ransomware group that was behind it. We had a year later, there was another incident that impacted the Hospital for Sick Kids. That's a premier hospital in Canada that only treats the most sick children, premature kids, and so on. It didn't have time to spread all over the network, but it was still another case of ransomware that was impacting their system. It was Lockbit at the time. There was an uproar in Canada over that incident, and there was a bit of drama, or depending on how you look at it, by Lockbit, who apologized publicly for hitting a hospital for sick kids, and even released the decryption key to say, we're sorry, we didn't mean to hit the hospital, and here is the decryption key. The problem is that the damage was already done, and the systems were encrypted and went offline. So this is the challenge that we are facing, and over the years we've seen a 3 times increase from one year to another as to the number of incidents in the healthcare sector. Now, partly is because people are reporting more, maybe people know the cyber center more, but or maybe there's more opportunities to find that. So what are we doing about it? A number of things. I mean, on the domestic front, it's all about education. It's all about advice and guidance. It's all about being out there, honestly wearing the T-shirt that says we're from the government and we're here to help. We flew people to Newfoundland and folks spent weeks there helping them mitigate the incident to clean up the network from the ransomware case. But it's not a scalable solution. But nevertheless, the Cyber Center is there to support those victims as much as possible. We're also, we want people to report incidents to us because we have authorities to go on the offensive, and we have gone on the offensive against some of those cyber criminals and made them pay the price. We don't talk publicly about who we went against, but the organization where I work has these authorities, and we've put them to good use to send a message to these things will not go unnoticed. So that's another way of making a difference out there. And internationally, Canada is part of the Counter-Ransomware Initiative and also stood up within the Counter-Ransomware Initiative the private sector partnership. So this is a recognition that counter-ransomware is not just for government bodies to meet and talk about, but also that the private sector has a role to play in there. And lastly, part of the G7, which Canada has the presidency, and I hosted Christiane and Ambassador Massimo, and Italy started last year. We have now a G7 cybersecurity working group. We are coming together and amplifying importance of things like AI and incentivizing cybersecurity and also IoT security, because more and more the healthcare sector contains IoT. And we've seen proof of concepts of scary things happening in the healthcare sector when you have a defibrillator, or you have an IV pump, or you have something that is IP enabled, and you could change all the parameters just because it happens to be on the network. So we want to raise the bar on the security of those devices too in that space. So these are some thoughts, but I'm sure we can go into a lot more details.
Yeah, sure. Well, you rose a lot. You mentioned already a lot of keywords that will come up in this following discussion. But first, let's this first initial panorama with Christophe about. So we are in France. Tell us a little bit. What is this? France is probably if one of the most advanced country in cybersecurity in Europe, if not the most. And health has been. I'm living in France, so I'm very glad to pay my taxes to have a good health coverage. And indeed, the problem, like Christiane said, very often the money is spent first to deliver health, whatever, to deliver what is needed to heal you and so on. Cybersecurity is coming after that. So tell us, what is the situation on cybersecurity? And maybe if you could mention also some, as Sami said, some attacks that happen.
Thank you, Luigi, and thank you for having me today. Indeed, I will go back a few years back. We had a lot of attacks for many years, like every country. We had some things that have been set up. For example, we have a dedicated CSIRT, a sectorial CSIRT that is only dedicated to hospitals and other health sectors. We have an obligation of notification for hospitals. Meaning that if an hospital is under an attack, he has to notify this CSIRT of the attack, and so it can be helped by the CSIRT. So all this was in place, but there was very few money. And as we said today, the balance between patient care and cybersecurity is often in the favor of patient care and not cybersecurity. So we needed to make something, but it was difficult to find this budget. In the end of 2K22, we had 2 major attacks near Paris, very large attacks, and this was a shock for everyone, including our government. And we decided to launch a task force to design a program to help hospitals to be more secure. We worked for 1 year. During this year, we started to launch some actions. For example, we asked every hospital to do a cyber exercise, a cyber crisis exercise. We have more than 2,000 exercises done since the beginning of 2023. And it's, for example, a major action for us because it allows to test the crisis organization of the hospital, but it also raises the awareness of the board of the hospital and the impact of an attack like that. In the end of 2023, so we published a plan, an action plan with 4 axes. I won't go further on the axes. Everything is online, but the main point is that we think that first we need to focus on raising awareness on the governance of hospitals and our national governance. So we have set up all many levels of governance, local, regional, and national governance. The next part that we think is very important is the problem of the task force. Today, we have a real issue. We have not enough cybersecurity experts. We already said that. But especially in the healthcare sector, probably the salary is not very attractive when you compare, for example, with the financial sector. So there is a problem to attract people and keep people in the hospitals to do this kind of work. So we are trying to mutualize actions on some levels. For example, we asked the territorial groups of public hospitals to set in place general governance for their cybersecurity experts. They have to have a team that can work on every hospital as a group. But also for every hospitals, we have set up a regional level, which is a center, a resource center, which can provide, for example, assistance in case of specific difficulty. Not only attacks, we really want to focus on the prevention. So we try to raise the resilience, the protection, the defense of the hospitals, and not only to react to the attacks. The main part of the program, of the action plan, is about the operational security of hospitals. As we said, as the budget has been very low for years, there is a huge technical debt in hospitals, and we have to help hospitals to regain some security on this part. So we have started with a first funding plan in last year, which is now about 1 month of its end, and we are launching the next one in the next days. And we are what we call domain in the action plan. So there are themes that we have grouped together. For example, the first theme was about the Active Directory systems in the hospitals and the exposure to the internet, which are 2 main pain points in current recent attacks. We are going also in the next domain, for example, on the prevention plan and the continuity plan for the hospitals and the backups. Today, unfortunately, on many attacks, we do not have enough backups or usable backups for many systems. And it's really a difficulty when we try to rebuild the systems. So today, all these actions are launched. Of course, they cost money. It's difficult to find this money today. And it's really an issue to demonstrate that these actions, these preventive actions, are offering a gain on the long term because they can avoid attacks. And these attacks cost cost a lot to hospitals and to the general system today. We have made some projections on the previous attacks between 2 and 20 million euros, for example, for an attack on a standard hospital in France. So it's really important, and today we have, unfortunately, many of these attacks again every year. So, good point. The first actions that we have set up has an impact. For example, we are in the French National Agency for Cybersecurity, ANSSI, and they reported in 2023, hospitals accounted for 12% of the ransomware attacks. Last year, 4%. So this works. Of course, it demands a lot of work for hospitals first. People are very, very dedicated to this work. And for everyone, of course, in the health sector, including all the people in the supply chain. Today, we think that this will be our next main challenge because the supply chain today is still very weak, including medical devices, and this can be a huge work for the next years.
Thank you, Christophe. Yeah, coming to this. Yes, I was reading recently that in the US, the typical cost of an attack in hospital is the order of $10 million average. And for a ransomware, typical money requested is $5 million. So that goes with what more or less with your what you were saying. Now, let's try, now that we set the scene and we warmed up the environment. So let's try to respond to this question, how to protect the health sector from malicious actor. And I would like to start with Christiane. I know that you, I know you when you started working, we were working on policy. And we have several policy in this sector. You meant NIS2, that not all the countries have implemented yet. You have GDPR. You have, now we're going to implement the CRA, how much the CRA is also dealing with the medical sector. So how, is this sufficient or you need more? Provocative a little bit.
So you're asking if we should make more regulation?
Yes, that was the provocative part.
Yeah,
the rest is just
just want to be sure that that's what you were really asking. I think we have put in place some very solid horizontal big frameworks that we now need to implement. I think it's far too soon to say we need new regulation, whether it's for sectors or whether it's for products, because we need to first make those we have work. And as you're saying, we're now working with the member states to get them transposed into national law, which is taking longer than it should, and I like to tell everyone this as well. And we're also sending letters to member states to make sure that we understand and focus on our efforts where it should be focused. But there is one part which is the legal work around it. There's another part which is the actual implementation of the frameworks. And I don't think that we should be thinking that just because a law has not passed in a member state, that they're not already busy doing a lot of things, working with the sectors to raise the bar. And I think this applies, of course, to our member states. It also applies to the work we're doing in ENISA. We're doing a lot of efforts already to make sure that whenever the legal things are there, that we're also ready to really implement and that we have already good hand around our entities. We work with them to raise the bar. Then we have, of course, on Cyber Resilience Act, which is a new kid in town, so to speak. And here we're also working a lot now for the implementation. It is going to be a big thing for our industry. It's a big thing when you suddenly have to start thinking security by design already in the development phase. It is a big thing when you can no longer just put your products on the market and forget about them, but you have to make sure that you do the security updates, that you do the patches. It does require a culture change, so there's a lot of work here as well. Whether it's around the standards piece, which is super important for industry, but whether it's around industry guidance, whether it's around investing, so industry have the tools ready, or whether it's around something which is very important for us as well, the global conversation. I heard in the previous panel, we were talking about, it's not a good situation when each jurisdiction is suddenly developing rules, because if you're a company that's operating on multiple markets, it's not very easy to navigate. and it's not necessarily good for security either. So here we're having some good conversations. We are having them in the G7. We are also starting now from our side in the counter-ransomware initiative. We're starting up work to have a global conversation around IoT security. So to say that this is also an important part of the work. So we're not bored in Brussels. We're not looking for more things to regulate. I think what we're looking at doing is really making sure that the implementation raises the bar. Then you mentioned medical devices. They're actually not covered in the Cyber Resilience Act. They have their own regulation, right? One of the things we want to make sure, and that's what we also announced in the action plan, is that we want to do a risk assessment. We want to take a closer look at the rules around medical devices, what's happening on the market, and are they up to the level they should be at? Can we say, are we feeling comfortable with the level of cybersecurity? And that's the work we're going to do now in the risk assessment, of course, to make sure that it's also part of. And then I think Despina also said in the previous panel that I would make advertisement for the CSA. So I will do that now. We are, of course, revising our Cybersecurity Act, but we're also revising it from a point of view about making things work.
Explain what is Cybersecurity Act,
The
because
Cybersecurity
not everybody
Act,
knows it.
Exactly. The Cybersecurity Act is where you find the mandate of our cyber agency. We need a strong cyber agency in Europe that can help us and help our companies and our member states where it makes sense in order to raise the overall bar in cybersecurity. So that's the one part. Second part is we need to look at our certification framework. Certification is part of the Cybersecurity Act. And I think certification is an important tool when you talk about supply chain security, when you talk about simplification for companies. So here we also need to make sure that the cybersecurity certification part is working. And then, as we also said, we want to take a broader look at the supply chain and see whether, you know, it all fits together and whether we have also good supply chain security. So these three things, along with a lot of work around simplification of incident reporting and simplification around security measures, are things that we're working on now. So it's not regulating to put more burden. We're very much coming from a point of view of regulating to actually support implementation and also drive forward simplification.
Thank you, Christiane. I would have one question to you, but then which would link with what I'm going to ask to Paolo, because AI is coming in strongly in the story. Where do you see, what kind of regulation would you use for AI? AI used in the medical sector, health sector.
So AI, I mean, of course, here we have in place the AI Act, which is key.
Yes, but it's sufficient?
This is not, I'm sorry, this is, I don't work specifically on AI, neither do I work on medical devices. What I do know is that, of course, we have the AI Act in place. We're now implementing it and we're covering it. And I also think there's a lot of people who are now talking about, you know, AI Act is doing this, AI Act is not doing that, etc. Let's all get it properly implemented. And then we can have a good conversation about how AI Act works vis-a-vis, you know, regulation, innovation, markets, etc. So I think also here the focus is really also on making it work.
First. Yeah. Okay. Thank you. Well, Paolo, so give us overview about AI is coming in everywhere. In the health sector, of course, AI as a defense, AI as an attack.
Yes, AI is clearly a topic that we can not discuss in any panel nowadays, so I'm happy to jump in there. But when we look at the impact of AI on the health sector, is not necessarily very different from the impact that it has on other critical infrastructure kind of environments. We have, from an offensive perspective, the implication of AI is that AI lowers the barrier to entry for threat actors and adversaries wanting to conduct operation. For example, we spoke about ransomware a lot. Nowadays, anybody with suitable access to one of these new development tools can easily generate an implant that can be then deployed against the target organization. This is normal way of life. Threat actors are not living under a rock. They would take advantage of whatever technology enables them to do their job more effectively. Now, I wouldn't want to be too dramatic here, because the same technology becomes available to defenders in this space. And this gives us, as cybersecurity defenders, it gives us an opportunity to deploy better detections approaches, ability to streamline operational flows and react and triaging faster cases as they get brought up by our security controls. And there is also a strong impact in terms of what the medical sector can do with these technologies when properly implemented. Like, ideally, a technology like generative AI opens the door to a wealth of research and opportunities and innovation that can improve how we as a society can take care of the health of our citizens, right? But before we get there, we need to sort out the issue of the data that we feed to these models. How do we train them? Who owns the model? When I add a prompt into the model, and that prompt contains potentially medically related PII or private information, where is the prompt going? Who owns the copyright to it? And in terms of response, what is the risk and the legal impact of a decision or an advice coming from the artificial intelligence? We are at the moment where all of these things are tempting and very close to us. We can grab them and we can start using them, but we as a society have not yet reached the maturity that is required to, let's say, use this technology in a responsible fashion.
Okay, so somebody, a friend was telling me AI is nice for B2C, but still not for B2B. It's not enough mature.
I would say it is mature, but the medical sector, the application
in
in
certain
sector is
certain specific.
Yes.
Okay, now let's go. Coming back to what Sami was saying before, because you mentioned also the private sector, the public. I'm very strongly positive with public-private partnership with ECSO and so on. But can you develop a little bit more how you see this, the link between the different actors, the public administration, the public hospitals or health clinics, the private suppliers, also all the chain that we were mentioning, the supply chain, which is very critical, but also the citizens, which are also need to be part of the, which are part of the game, which are the one which have the identity, maybe stolen or not, but are the patient in the hospitals. How all this ecosystem growing together and the cooperation?
It's a very complex ecosystem. I'm not going to pretend that we have the magic solution to fix it, but we are doing our best in Canada to make sure that at least there's a cohesive or a coherent way to address it. I'll say there's not enough money in the world to make the risk zero. Incidents will happen, so that we have to accept that there will be cyber incident. We're doing a great job defending the Canadian government, and I'm very proud of how we are defending the Canadian government with a lot of citizen data at its core. But that's not a scalable model to extend beyond government. So how do we build those partnerships? How do we educate? How do we share as much as possible? As I mentioned, Canada is a federation, so there is 10 provinces. Each province has its own regulation. Each province has its own set of privacy legislation. So our role is to convene those provinces and talk to them about at least having a coherent picture. I can't tell them what to do, but I can say this is probably best practice on how to do it. And this is what we would like to know as a cyber center in terms of what's happening in your jurisdiction. Again, there's no mandatory cyber incident reporting, but we encourage you to report incidents so that we can connect some dots. It's easy for us to be able to connect a dot of a hospital in Vancouver to a dot to a hospital maybe on the East Coast or in Quebec City or in Toronto. We then connect all these dots. So domestically, we look ourselves as an enabler of sort of getting the big picture. But as a federal government, we have a big role to play in building the partnerships with the private sector to encourage them to add our voice to that of the US and other international partners to things like Secure by Design or AI security, or all these things are very important. And the more we could speak in one voice, the better it is that it will resonate eventually. We don't, again, Canada is, relatively speaking, a small country when it comes to making a difference with the commercial sector, with the private sector. So how do we make sure that our voice is added to that of the EU, the US, Asia, Japan, and others, to say we want to raise the bar on IoT security, on medical device security, on building that security. And from a partnership perspective, I'll be the first to say we cannot do it alone. We need that partnership with the private sector, but it has to be seen as a two-way partnerships. And I think sometimes government are challenged with that two-way approach. We often say, give me, but we don't give back. And that's, we have to grow up and we have to find that sweet spot where we are comfortable sharing also with the private sector what it is that we need so that it is a meaningful partnership.
Thank you, Sami. And Christophe, how much are you cooperating with the private sector in France? This is 1 second. Actually, my original question was to you, coming back to what you're saying, because you mentioned a lot about the skills, and that's something that's very, very interesting. Yes. And because of skills, I mean, you can invest in devices, but invest in people is something else, and it's maybe less expensive, but maybe tackled from school level somehow. Yeah. So there are two different things.
It's first of all, the private sector is very important for us, and mainly because we lack skills. So today, for example, on the first actions that we have set up, we are heavily relied on many companies that helped hospitals to put in place the actions that we have asked. This is of course very important. Of course, the tools are very important. Today, hospitals are not developing cybersecurity tools, so they are depending on the private sector for that. We are not trying to develop national solutions, for example, except on very specific point and mainly on the measure of cybersecurity vulnerabilities, for example. We are trying to discuss with all the providers, medical providers, medical solution providers, and cybersecurity providers to explain where we are aiming, what we are trying to do, and see what they can do and which part of the path each can do. It's very important. For example, we are launching in the next months a funding that will be dedicated to remote access to the information systems of hospitals. Today, to be clear, in hospitals we have maybe 200 providers that have access to the hospital's information system. So it's very large, and these access are not always very well secure. So we need to do something about that. Of course, we have a lot of people working from home now. So today, information systems are widely open to the outside. We need to work on that. We're going to work with all these actors, so the providers that produce EMRs or medical devices and so on, they need to access the hospital system to maintain it, with the hospitals, of course, and with the cybersecurity tools provider to find the best way to implement something that fits for everyone. Of course, we hope to have a consensus. Maybe it will not be the case, but we hope that we will reduce the burden of negotiation today that an hospital has with a provider and a provider has with an hospital when it comes to remote access. So today we really want to build a confidence circle between all actors to be sure that everyone has done its part in the work.
How you do this? I mean, you do bilaterally, or like in the commission public consultation, or you do some big meetings where you, I mean, I understand you started discussion, which is already the first step to have a trusted public-private cooperation.
All of that. Today, we are working, of course, with the Commission, but we are making, for example, very large webinars for industrials, dedicated to them, explaining what we are trying to do and many of the parts that interest them. And we are making a very small group, small work groups on specific subjects with some large actors, for example, or which have specific solutions. So we try to use all the tools that we have at hand to progress on this cooperation.
Okay. So as we started 10 minutes late, Sébastien, we end 10 minutes late. Okay. Fine. Thank you. So I still manage 10 minutes more of the meeting, and before coming back to our panel, maybe I would like to ask if there is in the audience a couple of questions, quick ones. Yeah, there is one here, and another there, and a third there. Then maybe it's okay.
Good morning, I'm Barnaby Page with Sentinel-1, enjoying the conversation. There was a paper out last month by Cezanne Seymour at Coalition Insurance, and it talked about the majority of their claims are coming from misconfiguration in software, not vulnerabilities, but just software misconfiguration. So I'm curious if you have any data here in EMEA related to the primary cause of incidents in healthcare, such as maybe supply chain software like MoveIt, or is it vulnerabilities, or is it misconfigurations?
Wants to?
Yes, I can answer this point. Indeed, today we have a lot of issues that are misconfiguration or bad implementation of standards, to say. We are trying to explain to mainly the providers, because often hospitals are not aware of the technical difficulties and this kind of details of the implementation. So we are trying to work with the providers to tell them to strengthen their abilities and their field abilities, their field engineers' abilities, not only to have experts who know how to set up things, but that the people on the field that are going in the hospitals to install the system and configure them are aware of the cybersecurity issues and how they should do things and verify them. So we hope that with the CRA, we will have another level against these kind of providers who do not do the job. And maybe in the next year, we'll see a real raise in this in the quality of the installation. We have a lot of examples in recent attacks of course, often there is an account that has been leaked, but after that, often there are misconfiguration on the servers, on the applicative systems, and we really need to take that into account and build awareness for everyone. We cannot rely, an hospital can't know every kind of platform infrastructure that the providers build to them. They can't know all that. So we really need to force the providers to do the job and help hospitals to solve these problems.
Quickly, because I would like to have some other question, also other questions also to you.
But to your point also, I think we are also seeing a very traditional situation unfolding here, which is the pace of digitalization has been so fast that many environments that were not meant or not designed to be put online are instead put online.
Legacy.
Exactly. So what you're reflecting is, unfortunately, a problem that can be traced back to digital literacy, education, talent, and so forth.
Yeah, thank you. So let's come back quickly. Quick question and quick answer.
Good morning. Eric Saman with Palo Alto Networks. We've seen in the US, there's been a lot of debate around vertical integration in the healthcare sector and its effect on cyber risk and cybersecurity. Now, obviously in Canada and Europe, we're speaking more about public health rather than private. That's more into integrated care services. Is that integration of services networks between multiple healthcare systems, insurers, etc., is that increasing complexity from a risk perspective and legislation perspective, or is that simplifying for us how security should look like? Thank you.
Yes, it does add complexity. Of course, it increases the threat surface. Every connection opens up a new vector to be exploited. The fact that Canada is a public health sector does not mean that it's a closed sector. There is still some private clinics that are connected to the private health network to hospital connected amongst each other, and so on. So every one of those connections to me is a risk, and the question is how do we wrap our head around it? So I don't have we're encouraging people to tackle it locally first before they opened up their connections to others, but it's more about horizontal integration than maybe vertical integration from the way I see it.
Okay, there's the last question up there.
Thank you, Stéphane Gagnon from University of Quebec. So a pleasure to see Mr. Khoury here. And my question is about collaborative R&D. All vendors require great partners to develop cybersec solutions. Now, the healthcare sector is beautiful because differently from others, it has already a very strong, well, of course, medical, clinical research philosophy. But it has, though, as an institution, hospitals are ready to do collaborative R&D. So is there a chance, perhaps, that there would be in the portfolio of medical informatics research a focus on medical cybersec and or healthcare cybersec as part of those portfolio of R&D? And there would be a chance for universities, therefore, to have an open door with those hospitals to do that kind of collaborative R&D. Are any agencies anywhere doing any effort in that realm, please?
Who wants to answer? Christiane, you have an idea?
Maybe just small example in France, indeed INRIA, which is the national agency for research in IT, has a specific team that works on medical solutions. And 1 year back, I think, they started to cross their experience with the security team of the INRIA, and we have worked with them to build some cooperative network on research on this aspect. But indeed, today we have real subjects, especially in the industrial sector, to get the two sectors to cross and to work together. There are some initiatives in France, but they are not working very well today.
Okay, that's actually bringing me to a question I wanted to have to Paolo. What kind of R&D would be needed in this sector, specifically for this sector, or just the same products and services everywhere?
I think when we speak about the medical sector, I feel
quick,
very quick,
because we have to go.
Okay, we need to distinguish between two types of R&D. The one that is cross-domain, so not specific to the medical sector, that should follow general guidelines. In the medical sector, we need to start driving education in terms of what it means to do security-driven design, security-driven implementation, coding, threat modeling, so that gets then trickles down to the software and medical devices used in that industry. It is a shift in mindset, and I think some of the regulation that is being passed now is going to help in that sense, but it is important that we start approaching the situation from a different perspective.
Christiane, is the Commission going to invest in this R&D or other capacity building?
So for also what concerns your question, I mean, the work we're doing, for instance, around digital health, around the European health data space, everything which is around driving, let's say, research and development also through data, there is a very important security component there, of course, already. Then on top of that, we are also looking at, through our different investment programs, whether it is on the research program Horizon or whether it is via our deployment program in the Digital Europe, we are also investing specifically in these topics. So there is, of course, work going on, but I also agree that I think when we're looking more at, let's say, higher TRL levels, that it is important that we have the projects that actually bring the two sides together. More that we have the projects that bring in the security dimension into the work that's going on to develop the medical devices, for instance, or going in to develop the models that we work on for the AI that's applied to it. So, you know, there is effort going on, but of course, as we move forward, I think this is an area where we will also be focusing.
Yeah, and I can imagine that a lot to do and it will grow. Quick one to Christophe and Sami. As a country, where would you like to work with other countries? Which sector in the domain, of course, also on health, cyber and health? You do already something in your country, you want to cooperate. What are the suggestions, for instance, to the Commission?
Today, I think we are the borders for us in France, at least, are not really interesting and meaningful. Today, we are working on a European level, at least, often with the providers, with worldwide providers. So today, borders for us is not a subject. European and sovereignty is a subject because we need to have at least technological independency on some part of our infrastructure. But that put aside, today we cannot, for example, we are discussing with an international provider which works as well in Japan, United States and Europe. We cannot ask him to do specific things, very, very specific things for France, for example. It's really meaningless. So we really need to work with everyone. And today, as we during the work on the action plan, on the European action plan, there is a lot of actions that have been taken in many countries, and it was very interesting to share all that. So I think today we need to share very largely and in all sectors. There is no reason to be focused on France, for example, for us.
Okay, Sami?
In the space of cybersecurity, I mean, we have a very deep-rooted partnership with the US. I think we're growing our partnerships with the European, the EU and countries there. So I would say if there was, I wouldn't say one particular sector, but I would say cybersecurity touches many, many sectors. So I would say we need to grow those partnerships.
Open to cooperate.
Yeah.
Okay, very last question because otherwise Sebastian will kill me. But it's a very personal one, a very quick one. I told you already before starting. You suppose you are a wealthy person and you want to donate 1 million euro from your pocket and to donate in cybersecurity for health. Where would you like to donate? Paolo.
My investment or my donation would go towards university and organizations that provide increased digital literacy and security literacy for the public.
Sami?
I would give it to the Children's Hospital in Ottawa.
Christophe?
It's very difficult for me because I have to make this choice every day. So I think that today education is the main, on the long term, is the main challenge. I'm
not surprised. Well, your leitmotiv today. Christiane, you are the last word.
It's nice that someone will give me money that I can pass on, because normally people just come and ask for money. I think I would give it to our cyber agency, actually, for the action plan for health, because this is an area where we are trying to raise the bar across the board, and we're going to be able to really help hospitals on the maturity levels. So for me, I would give it straight on to our good cyber agency to help us do the work.
Okay, thank you very much, and round of applause to our panelists. Thank you.